Senator Hanson.
Thank you very much. My question is to the Minister for Women and Government Services, Minister Gallagher. In a letter from Services Australia dated July 2nd, 2025, it confirms that the stillborn baby payment of $4,326.57 is available in cases of intentional abortion where a pregnancy has reached 20 weeks or the child weighs 400 grams. While One Nation supports the stillborn baby payment for legitimate and heartbreaking cases, Minister, why is this payment being made to women who deliberately abort a baby?
Thank you, Senator Hanson. Minister Gallagher.
Thank you. Thank you for the question. I know that there is a number of steps that are taken before a family that's been affected by stillbirth are eligible for that payment. It includes a number of different pieces of documentation, but that payment, supported by that appropriate documentation, will be paid in those circumstances. It includes, in often quite traumatic circumstances, as you can imagine, evidence of the stillbirth from people who were attending the birth. That is required before the payments are made, associated with other documentation that's required by Services Australia to make that payment provided. We accept that in the case of stillbirth, it is a very traumatic situation for anyone who is involved in that. And I think even applying for that payment at times can be quite traumatic, and so we've looked at ways to make sure that that is as seamless as possible. But like every other payment that's required and provided by Services Australia, those payments are made in accordance with the law and in accordance with guidance and evidence that those payments are appropriate. It's that for whether it's job seeker, whether it's single parenting payment, whether it's PPL, and in the case of the loss of a baby through pregnancy loss, those payments will be made when that is supported by evidence that's required by Services Australia.
Thank you, Minister. Senator Hanson, first supplementary.
Well, Minister, you never answered the question, which was, why is it made to women who deliberately abort a baby? Minister, this policy risks creating a financial incentive for late-term abortion where Australian women can terminate a pregnancy up to the day before birth. They can terminate a pregnancy up to the day before birth, allowing women to receive a lump sum payment and access to paid parental leave of up to $22,754. Why is the Albanese government funding the murder of healthy babies, some left to die in a kidney dish for up to 5 hours?
Thank you, Senator Hanson. The time for asking the question has expired. Minister Gallagher.
Well, the answer to that question is the same as to my earlier question. There are laws in this country around termination of pregnancy. They are laws that are regulated by the states and territories, and I support those laws. One of the reasons I got into politics was to ensure that women had the right to make choices about their own reproductive health. I accept that some people disagree with my views on that and with laws in states and territories that provide the regulatory arrangements around that. Now, in relation to the stillborn baby payment, as I said, and as it relates to other payments, including PPL, evidence is required, documentation is required before those payments are made. In relation to the stillborn baby payment, that includes certification from someone attending the birth, a health professional attending the birth, that the birth was of a stillborn child. That is the documentation that's made or required in order to receive that payment.
Minister. Senator Hanson, second supplementary.
Minister, when you talk about stillborn births, let me inform the people, the public of this nation, that they are actually injecting a needle into the heart of the baby that before it's born, therefore it is born stillborn. Minister, will you and the Albanese government work with One Nation to close this appalling loophole and ensure these taxpayer-funded payments are reserved for genuine cases of stillbirth, not for barbaric late-term abortions carried out by choice?
Thank you, Senator Hanson. Minister Gallagher.
Thank you. Well, my answer to this is as it was to the earlier two questions. I have not seen any, and I have not had raised with me outside of this chamber right now the concerns that Senator Hanson raises with me. But in order for a stillborn baby payment to be paid, what is required is a paper-based form from the hospital containing a doctor and midwife's declaration that it is used as a verification of the stillbirth. That is what is required to get that